Hi, this is Dr. Bob Dannenhoffer, Public Health Officer of Douglas County here in Oregon. This is another of our Facebook Lives. Tonight is August the 10th, and I will tell you this has been the worst day of our pandemic. Again, this is a time for us to answer your questions. We've already gotten quite a few on Facebook questions at douglaspublichealthnetwork.org, but you can also put them in the chat section, and we'll try and get to as many of them as we can tonight. Well, why is it the worst time of the pandemic? Well, if you look in the world, there's a steep rise in the number of cases. Again, most of the population lives north of the equator, so this is in the midst of summer where we're seeing a steep rise in cases. We're seeing a rise in Africa, in many different countries in Africa. And again, Africa is a concern because they've not had much experience with the disease. They have low vaccination rates, and they're just the prime setup for new variants emerging. Asia is starting to see more cases, especially Malaysia, although when we look at Taiwan, South Korea, Australia, New Zealand, they continue to have a low number of cases, although when they do have an introduction of the Delta variant, they struggle a little bit. The UK, which we've been following very carefully because the UK kind of predicts what's going to happen in the US, they're starting to come down, but they're still at a very high level of cases, at about 41 cases. South America, which has been a mess for months and months and months, is quieting, where we're starting to see more cases in places in the Caribbean. In the US, we have a very steep rise in cases. Every single one of the states, 50 out of 50 states, is increasing. We have a especially dire situation in Missouri, Arkansas, Louisiana, Alabama, Mississippi, Georgia, and Florida. I mean, it started to seem in Missouri, and about 6 weeks ago I said, there's something funny happening in Missouri, and it was right, and now it's sort of dripped down. All of those areas are still rising. So for Missouri, 8 weeks, they're still rising in the number of cases, which is a little worrisome because they started rising because they had Delta variant, and you'll hear that Delta variant plays again and again. Oregon is still very hot, 2,000 cases, especially in the Gorge, Jackson, Josephine, Coos, and Curry County. But again, we go some places where Douglas County has more cases than Multnomah County, a county much more our size. And again, Douglas County today had more cases than Washington, D.C., the county that has Boston in it, and the entire state of Vermont. So we're really red hot. Today, we can't even count the number of cases. We'll go through it. I think we had 139 cases as of noon today, and then 54 more cases just this afternoon. I was in clinic this afternoon. 2 kids came in for well visits, not because they were sick, and had symptoms and were positive for COVID. So there's a lot of COVID going around. We had 4 deaths today, and we likely will have another 1 or 2 through the night. And there were 42 in the hospital. Now this is, of everything, probably the most concerning thing. The hospital's full. ICU is full. The hospitals in Jackson, Josephine County are full. The hospitals in Lane County are filling up. There's still some beds in the hospitals in OHSU and Providence, but if we start getting more and more cases, as we inevitably will, those hospitals will also fill up, and then people who have heart attacks, car wrecks, and whatever don't have places to go. And when we look at those places, those hospitals are really struggling. We're averaging 88 cases a day, and we know that about 8% of our cases wind up getting hospitalized, usually a week or 2 later. So we're averaging 88 cases, 8% of that is 7 cases. So every day we're adding 7 more people to the hospital. And unfortunately, the people are staying in the hospital for a long time. They're not getting better in a day or 2. They're staying in the hospital a week, 2 or 3, and the hospital's just filling up. And especially taking a lot of the respiratory therapy stuff that they need. So they're on oxygen or BiPAP or Airvo, all things that require a tremendous amount of space. So right now we're in a really difficult situation because we not only are a lot of people getting it, but a lot of people are getting really sick, a lot of people get hospitalized, and a lot of people are dying. So this is really a time, if we want to concentrate our efforts to try and get this down, we can. So let's get to the questions here and see what we got. So the first question, It's been one of those days. Okay, there we go. So the first question that we have is, are we still doing contact tracing, and do we send letters to cases? So the story is that during most of this pandemic, when we were having 20, 30, 40 cases a day, we had enough staff to call almost every patient. There was occasionally people we could not get a hold of, didn't have the right phone numbers, they didn't answer the phone, and in those cases, we typically sent a letter. As we have more and more cases, we have more and more people that we can't reach, more and more people that have phones that are not in service or won't answer a call, and in those cases, we do send letters to cases. Now again, cases are either confirmed cases, those are people who have a positive test, but then there are some cases which are presumptive cases, and those are still considered cases. And presumptive cases are people who are close contacts of a case and have typical symptoms of COVID. So this is not just anybody who has fever and cough. You have to be a close contact of a known case and have fever and cough or loss of taste, and then we would consider that a presumptive case. The other way you get to be a presumptive case is you're living with somebody who's got the disease. You say, look, I don't have that thing stuck in my nose. I think I probably have it. That's a presumptive case. And the third way you get to be a presumptive case is you think you have it, you go to one of the stores, you buy a test, you do the test at home, and the test is positive. That's considered a presumptive case. So for example, today we had 10 presumptive cases because we had a bunch of people who did their tests at home. We previously sent letters to people we couldn't reach who were cases, confirmed cases and presumptive cases. It's a little confusing because you could be a presumptive case and not have a positive test. So we're going to figure out some other way to identify presumptive cases. So somebody says, please speak to breakthrough cases, deaths, and hospitalizations. So breakthrough cases are cases where people who are fully vaccinated wind up either getting the disease, hospitalization, or death. And what we noticed that of our cases, about 10% of them are vaccinated. So about 10% are vaccinated, 90% not, still suggesting that the vaccine is working very well. When we calculate the vaccine efficiency, that is how well it's actually working, depending on what numbers we use, we get 75 or 80. So the vaccine is still very good at preventing symptomatic disease. In terms of preventing hospitalizations, it's also very good. So we pulled this number last night looking at the people who were admitted to Mercy on Sunday. We knew who they were, we knew their names, we could actually track down their vaccination status. There were 38 people in the hospital. 33 of 38 were unvaccinated. 2 were vaccinated with the J&J, and 3 were vaccinated with the mRNA, suggesting that the mRNA vaccines are still very good, perhaps 90% effective against preventing hospitalizations from what we know. So that mRNA vaccines extremely good at preventing hospitalization, still very good at preventing cases. Not being vaccinated, terrible. Obviously not vaccinated at all. And the J&J is some protection, but not as good as we'd like. And again, this is not shocking. You remember when the J&J came out, it was basically its point of preference was that it was a single dose. We knew it produced less antibodies than the mRNA vaccines, but back at the time that it was approved, back last year, the variants that were out there, at that point it was really just the ancestral strains and the D614G, and all of the vaccines work perfectly well. However, as we've now moved to the Delta takes a lot more antibodies that you produce to get rid of it. And so it's not surprising that the mRNA vaccine is still performing pretty well and the J&J a little less well. What we're going to need to know about that is what we do now. Do we give a booster to the people who got the J&J? Do we give them the second J&J? And we're desperately looking for that information about what to do. But again, the mRNA vaccines, which is the overwhelming majority of what people in Douglas County got, still seeming to work very well against hospitalizations and breakthrough cases. Deaths, we have just a small number of deaths. Again, the vaccines seem to be working, but it's pretty hard to calculate those numbers. So are the presumptive cases driving up the number surge? What is a presumptive case? We talked about it. It could be you're a close contact of a known diagnosed case that is diagnosed with a test, and you have the typical symptoms, but you've not yet had a test. Or the test you've done is a home test, and we're not, the home tests are pretty foolproof, but they're not 100% foolproof. So we're still considering those presumptive cases. We are seeing a little bump in the number of presumptive cases because, if 4 people in your house test positive and you have the same symptoms, people say, look, I'm not even going to go ahead and get the test. We're seeing more people buy the home tests. And the other thing that we're seeing is that some places are running out of tests. With this many more cases. And again, the numbers of cases are striking. We're averaging over 80 cases a day. We never had a time when we had more than 41 cases in a day just 2 weeks ago. So we go from 41 as our high point, averaging during the entire pandemic about 9, now to 80. So almost 9 times the amount of disease that we averaged in the past. So the presumptive cases are not driving up the number surge. Most of these are confirmed cases, although we do have some presumptive cases. So there's a letter from a 14-year-old said you count her as a case when she wasn't one. She was a case. She was a presumptive case. She was not a confirmed case. So I'm not going to go into the specifics of this, but this was somebody who was exposed to a known case. She had the symptoms. She'd not yet been tested. So she was a presumptive case. And so that wasn't wrong. So one could see how you could look at this letter and read it differently, but this was definitely not wrong. So what is the average number of cases per day? Over 80. Looks like things are exploding. Please give us some numbers now. So the average age of those testing positive, it is shifting to younger and younger. It's now in the 40s. You remember that last year it was in the 60s. And our 2 biggest age groups of getting this are the 20s, are the most populous, the 30s, and then kids. So it's really mostly spreading among young people, again, because many old people have already gotten the vaccine. So when we looked at the last 767 cases, 91 were between 0 and 18, 166 were between 19 and 29, 122 were between 30 and 39, and 96 were between 40 and 49. So these are mostly young people. But again, when we look at the hospitalizations almost always in the past, when we look for older people, now we're seeing more and more and more young people being hospitalized. The median age being 50, so that is really, really low. Are we having more folks getting tested? Yes, we're having more folks getting tested, but not 10 times as many. We're having, so our positivity rate, that is the number of positive tests, for most of this pandemic for Douglas County has been less than 5%. Occasionally we bumped between 5 and 10%. We're now over 18% positive, meaning that we're both doing a lot more tests, but we're having a lot more positives. And would not be the least bit shocking for me to know that there are more cases out there that we're not finding because people are not getting tested. So what percentage of the new cases are folks that are not vaccinated? About 90% of the cases are people who are not vaccinated. 90% of the cases are people not vaccinated. This is really puzzling because the vaccines are out there, they're good, they're effective. There are some side effects, but the disease is so much worse. So 42 people in the hospital with COVID, none in the hospital with COVID vaccine side effects. So again, it is overwhelmingly in our favor to be vaccinated. So I had a scheduled echocardiogram today done at the Heart Center. I was sure that everybody would be following the safety protocol, but then there were construction workers without masks. Does the mask rule apply to everyone, even employees? So the mask rule in healthcare facilities applies to employees and contractors. So in the hospital, there are mostly employees, but there may be people who are either contractors working there or people work in the hospital who are contractors, and they are also supposed to wear masks. So the national news is reporting 92,000 cases of pediatric COVID. Do you know what percentage is under 12 and more specifically under 5? So I don't have that specifically here, but again, there's 91, 0 to 18. We have a bunch under 5. as young as 2 weeks. One of the kids I saw today was four who had it. So it really is, there's a lot of disease, and there's a lot of disease, and it's all ages now. Although strikingly, when I looked at people 80 and above, there were not that many people 80 and above. I think those people 80 and above are either vaccinated or they're staying home. So my husband can't get into local specialists until December, so he's going to one in Springfield. He's fully vaccinated. They're required to do a COVID test 3 days before the office visit because of Delta. And the question is, what kind of test should it be? You have to ask the office. I've been helping a bunch of people with these questions. They're traveling, or they're needing to have an operation, or needing to do this. And when I've checked, almost all the places have their own rules. Some require any test, some require a PCR test, some require a specific PCR test, and so you need to call them and find out what test would be appropriate. It used to be that when you wanted to be tested for COVID, you needed to wait to have it done for 5 to 7 days for it to accumulate enough material to be accurate. Is this still the case now with different tests for the Delta variant? Well, the Delta variant does rise quicker. So we're seeing that in the past that the average was 5 to 6 days. Now it's quicker and quicker. Sometimes as early as 3 days, people are now symptomatic. Typically the best time to get the test now is 5 days after exposure. If you get it 3 days after exposure, it may be too soon, and it may not have built up yet. If you wait, probably 7th day would be the most accurate, but then you have to wait 2 more days. The new tests are very good. So the Binax tests have been remarkably good. It looks for the N protein, which is not affected by the vaccine. The N protein is not even in the vaccine. And so it's been a very good test. The spike protein has changed a lot and has made some of the PCR tests a little bit more complicated. It has not at all affected the N, or has not much affected the N protein, which is what the protein antigen tests are looking for. So many towns have festivals, other outdoor gatherings planned for the end of summer. Are there new guidelines for organizers of outdoor gatherings? There are not any new guidelines. Again, outdoors we think is so much safer than being indoors, but we're seeing the fairs. Lane County had a fair, Douglas County had a fair, Jackson County had a fair, and we're seeing some reports of cases coming from the fair. Although when you talk to young people, having been at the fair includes almost everybody, and your ability to know who you were close to at the fair and who you might have got exposed would be almost impossible to tell. Now, interestingly, other countries are doing this thing where when you have a case, it uses this technology to find which cell phones you were around the time that you're probably contagious, and then it sends them a ping saying, on last Thursday you were within 6 feet for a while of somebody who subsequently tested positive for COVID. You should take precautions. We do not do that in the US. So there's an understanding that the Delta variant is the predominant COVID variant raging across the US. That is true. How do we know which variant is present in the majority of cases in the population of Douglas County? Well, we send some specimens. Our last 8 specimens were 8 of 8 for Delta. In Oregon, the last 65 were 65 of 65 that were Delta. So as best we can tell, everything that's circulating is Delta. And why does Delta matter? Well, it matters for epidemiologists because we know the Delta is much more contagious than the previous Alpha, which was much more contagious than the ancestral form. And can we get a number of cases per variants present in Douglas County? As I said, 8 of 8 for Delta. And how do we know this data? We know this data because these specimens were sequenced at the Oregon State Public Health Lab. Is there genetic testing to determine variants? Yes. So what they do is they look at the genome, the whole sequence, and they can tell what of the sequence, which one is it most like. And again, they've all been Delta. So is there a procedure to determine variants? The procedure is that we send specimen to the state lab, and the state lab does sequencing, and they give us the results. Is there any breakdown of positive cases by town and city? I wish I could say there was any part of the county which is untouched. It's everywhere. We're seeing North County, we're seeing Reedsport, we're seeing Douglas County, we're seeing Central Douglas County, we're seeing Glide, we're seeing South County. It's everywhere. So I have several family members who refuse to get vaccinated. I was wondering if it was safe to visit outside with them. The family members have children, it's very hard not seeing them. Yeah, are there precautions that need to be taken? Well, this is really heartbreaking for families where there's some vaccinated and some not, people looking to be safe. Again, outdoor visits are so much safer than indoor visits. So we think outdoor visits probably a factor of 10 or more safer than indoor visits. So if you're going to visit them at the park, visit them outdoors, and that makes it very safe. So this comes to the whole Obama birthday party. It was like, why'd you have this big birthday party? They had it outdoors, and so the risk was lower. And they said, well, what about these guys going to Sturgis? Well, it's the riding the motorcycle is probably zero risk of COVID, maybe risk of other things, but almost zero risk of COVID riding on your motorcycle. So I don't have any trouble people riding their motorcycle to Sturgis. However, if now you go inside a bar where there are a bunch of people, or go inside a restaurant where there are a bunch of people, that is a risk. So many people on Facebook are taking this article, quote, to mean that if we've had the vaccine, we are shedding the virus. No, you're not shedding the virus. In fact, the vaccine, all of the vaccines, do not contain the parts of the virus to make this a virus. They have the spike protein, which is the thing that your body makes an immune response to, but you're not. So if you get the vaccine, you make a response to the vaccine, you're not shedding the virus, you're not an asymptomatic person. Now, you can get the vaccine and still get the disease, right? Because the vaccine doesn't work 100% of the time. You can still get the vaccine and get the disease, but at a much lower rate than if you're not vaccinated. And so the story is, yes, you could, if you're vaccinated, you can get a case. Your case could be asymptomatic or symptomatic. If you're not vaccinated, you're much more likely to get a case, either asymptomatic or symptomatic. So please get vaccinated. So I'm curious, we hear how immunocompromised people can't get vaccinated. That is not true. So everybody can get vaccinated. Even if you're immunocompromised, you can get vaccinated. The problem is that when they get vaccinated, they don't make a good response. So the people we know this best in are people who had solid organ transplants, either kidney transplant or heart transplant. And those people get really carefully followed. So we know a lot about people who had organ transplants and they've gotten the vaccine. What we find, though, is that because of the medicines they're on that suppress their immune system, so they won't reject their organs, right? So you can't just put a kidney in somebody and expect it to live. What would happen is if you put somebody else's kidney in me, my body would say, well, wait a minute, that's not my kidney, and it would reject it. So to prevent my body from rejecting it, you have to really weaken my immune system so that my immune system won't reject that kidney. And I have a bunch of kids with kidney transplants and heart transplants, and so they're on this medicine and very carefully followed. Well, this medicine not only prevents them from rejecting the kidney, but it also tremendously decreases the amount of antibodies you make with the vaccine. And so these people have been very carefully studied. And what we find is that a good percentage of the people who have solid organ transplants just don't make a good immune response. Now, the good news is that with a booster, they might make a better response. So that is the good news. So it's not that immunocompromised people can't get vaccinated. It's that when they do get vaccinated, they just don't make good antibodies. They may not make good antibodies. Now, what is shocking is that some people who've had solid organ transplants and are on this immunosuppressive medicine still make a pretty good amount of antibodies. That's one of the things we're going to have to figure out what's going on there. Since so many people compare COVID-19 to influenza, how closely is this pandemic following the course of the Spanish flu? Well, very different viruses spread in different ways, but what we are seeing is that there were waves with the Spanish flu, and there were waves with COVID-19, so that's a difference. The other thing that we saw is that the Spanish flu did change a little bit. This one actually has changed a lot more than the Spanish flu ever did. And what about deaths? Well, the Spanish flu in 1918 was similar to a flu that was there in the late 1800s. So many older people had antibodies to the Spanish flu by 1918, and older people didn't get sick, which was a little unusual for a flu thing, but young people really did. So I mean, there's lots of similarities and differences. I mean, it's like a bicycle in a sports car. I mean, they're both have wheels and they both go, but there's some similarities and a lot of differences. So can we talk about the different tests for COVID? Okay, so I'll get to the last part of the question. I'm recovering from a breakthrough case of COVID, but still have fatigue and congestion. We have long-standing plans to visit an elderly relative next weekend. 18 days after the onset of symptoms, so you should be good. So my husband and I plan to get COVID test before going to visit her. There is no reason if you've already been positive to get a test. It does not help at all. In fact, the only thing that a test 18 days after the onset of symptoms could do would be to confuse the situation. So let me explain a little bit about that. So Diana, for the person who was positive 18 days ago, please don't get another test. It's only going to confuse things. For people who have not been sick, getting a COVID test might help. So there are a couple of different kinds of tests. So the first test that came out was a PCR test, a polymerase chain reaction test. This is an incredible test. What it does is it looks for little bits of, in this case, RNA that are in the virus, and that when you're making when your body is making an infection or having an infection, it makes multiple copies of the mRNA of this RNA, and this RNA sits around in your system. Some of it gets inside the cells and makes new viruses, and that's how you get infected. What happens is this RNA that you get from COVID can stick around long after your infection is gone. And so they typically stick around for weeks after the infection is gone. We know that in a normal immunocompetent person who's not been hospitalized, by 10 days after the onset of the illness, you can never make competent virus. That's a virus that could spread to anybody else. So after 10 days, you don't need to get tested again. After 10 days, you can go ahead and be free of disease. The problem is that these tests are so freaking sensitive that little bits of RNA that stick around your nose for days or weeks after the infection is gone can show up positive on the test. And so if you did a PCR test 18 days after the onset of symptoms, there's a likelihood, probably some reasonable percentage, that you would test positive, but you wouldn't be contagious. And that's why if you tested positive but weren't contagious, it would just confuse the situation. We call these dead bugs on the windshield. So, you've driven around and you have these dead bugs on the windshield. When you look, they clearly were bugs at some point. They were clearly alive at some point, but now they're dead bugs on the windshield. Similarly, the stuff that the PCR picks up 2, 3, 4 weeks later are dead bugs in your dead mRNA in your nose. It's not going to cause any troubles, but you can still detect it. The other kinds of tests, so there's a PCR test. So the first PCR test done in the laboratory, looking for 3 different strands there. It's absolutely sensitive, specific, great test to do, hard to do, expensive, costs many dollars, $100 or so to do the test, and takes a few days to get the results. Those tests are great. Early on, those are the only tests we had. We use those now if we want to do variant sampling, because to do variant sequencing, you have to do one of the bench kind of PCR tests to find out if you have enough viral load so that you can do the sequencing. Those PCR tests are done in the big labs, none in Douglas County. There's some in Portland, there's some in Eugene, and then the big national labs do those. The second kind of test is a more rapid PCR test that uses different ways to multiply the disease and looks for the RNA. Those are tests like the Abbott ID Now tests. Those are tests like the Thermo Fisher tests, and those are good tests. They also, though, look for the genetic material and can stay positive for well after the disease is gone. The third kind of test is an antigen test that doesn't look at all for the genetic material, but looks for the protein. And that's like the Binax test that we do now. And the Binax test is great because it's fast. It looks for the protein. It tends to peak when you're sick and go away when you're well. So those ones go away. So in your case, if indeed you are 18 days after the onset of symptoms, don't get another test. If your husband who didn't test positive wants to do it, he should get a test, and any of the tests would be okay with him if he didn't already have the disease. That is really confusing, but I hope it makes sense. So a friend was vaccinated for whooping cough last year and had an awful reaction. He's now hesitant to get the COVID vaccine. Any thoughts? Well, the whooping cough vaccine is a tetanus and pertussis, which is whooping cough, and diphtheria. People sometimes get reactions to those. What's in those is totally different from what's in the COVID vaccine, although there are some people who just have really reactive systems. When they get a vaccine, they get high fevers, and then other kids we see given vaccines never have fevers. Both kinds of kids seem healthy, but there are some kids who are more likely to have it. So I think because they had a reaction to one vaccine, they might have fever with the other. But again, the 1 day of fever and feeling crummy that you get with the vaccine is a whole lot better than the disease. So do you have to quarantine with a positive household member if you're vaccinated? So officially no. So you live in if you're vaccinated and somebody you're around, either in the household or otherwise, has COVID, you do not need to quarantine because again, your risk of getting the disease is really quite low. However, with the Delta, we're seeing, with the Alpha, it was extremely low. It was so low, in fact, that it didn't even make sense to get tested or do anything. With Delta, because again, the Delta is a much worse virus, is a much worse variant. There is some chance that you could get it should you test even with no symptoms. So this is what I would do. I'm vaccinated, household member had it, I would lay low for a week and get tested in a week. If I lay low, didn't have any symptoms, tested in a week and was negative, and I could test with any of the tests, then I would consider yourself good. Catherine says, what's the latest on boosters? Geez, I wish we could get some guidance on this. The story on boosters is that you might need a booster with this. And the reason you might need a booster, you need a booster sometimes because immunity wanes. I don't think it's waning enough that that's the reason you need it, but I think you need the boosters because some people just don't make good antibodies. We talked about people with solid organ transplants, older people, and some people for whatever reason just don't make good antibody responses. In addition, remember we talked about the J&J vaccine not giving good response. We have no official guidance on boosters. I'm hoping like crazy that we in the next few weeks are going to get some kind of guidance that this group should get boosters of this kind. So we don't know, for example, with the J&J, if you get a booster, should get a booster J&J, should get a booster Moderna, should get a booster Pfizer. I don't know the answers to that. Should you do for people over 80? Maybe. People on immunosuppressive meds, maybe. People over 65, maybe. So I don't know the answers here. We're just hoping that we get good answers soon. So Lane says, the patients out of the state, is that for ECMO? Yes. How many ECMO beds do we have in the state and how many already in use? My understanding was, and I'll need to check on this, that we had 8 and 8 were already in use. So ECMO in a usual time is not used very much. So in my whole 40 years of doing this, I've had one person who was on ECMO. And so a rare thing, typically be somebody with something bad in their lungs. They would have had smoke exposure, and they would have singed their lungs, and their lungs weren't working. Sometimes a really bad pneumonia, sometimes somebody with cardiac failure after a transplant. So this ECMO machine not only puts oxygen there, but also pumps the blood around. So you could imagine if you were having a really failing heart, you could do this. And then I had a patient with cystic fibrosis who was looking for a lung transplant, and they had him on ECMO waiting that. So ECMO is not widely used. And at the beginning of this pandemic, I can remember, it's hard to believe, in February of last year, we had a patient who needed to be on ECMO. It was the last pre-COVID patient that was on, that needed ECMO. And there was a big to-do about him being tested for COVID and whatever else. So it's there. So all the beds in Oregon were taken up for ECMO, and then they went to Washington. My understanding is the ECMO beds are right on the edge right now. They typically free up when patients die. So it really is a problem. So tell us about the Delta Plus variants. How much stronger is it? So the Delta Plus variants, the AY2 and the AY3, still don't know a lot about them. They are similar enough to the Delta, and we're not sure they're going to be any different. However, we do know that this new one called the Lambda, which came from Peru, we don't know that much about Lambda, but it does seem to have things in it that would make us think that the vaccines are going to be less effective. So how effective is the mRNA vaccine against the Delta variant? So again, looking at our hospital data, so we had about, let me get this number straight for you here. So what we look at, again, this was the hospital data, the Mercy Hospital data from Sunday. So 33 out of 41 or 42,000 adults who were unvaccinated got the disease. There were also at the same time about 40,000 adults who had 2 doses of mRNA. Only 3 were in the hospital. So 33 unvaccinated versus similar number 3. So about 90% protective in protecting against hospitalization. When we look at it for cases a little less good, about 75, the mRNA vaccine is about 75 to 80% against symptomatic infection. And this is where you're going to get some of the breakthroughs. So we have a staff member who got his 2 mRNA vaccines and has had a mild case of COVID. So it happens. Has the exposure time changed with Delta, or is it still 15 minutes? Officially, it's still 15 minutes. Although when you get a more contagious virus, presumably shorter times are still infectious. And we have one pretty well documented case of somebody who had fairly short exposure to people. So a new employee went around visiting people, had fairly short and still infected a lot of people. So yeah, so officially it's still 6 feet and 15 minutes, but with a more contagious virus, it would likely be a shorter period. So the vaccine doesn't keep from getting COVID, it just prevents death, right? No. So the vaccine, about 75% of the time, prevents you from getting any symptomatic case of COVID. So it's still 75% protection against getting symptomatic COVID, about 90% protection for hospitalizations and deaths. So 75% from getting COVID, from getting symptomatic COVID, about 90% for you preventing death. So still very good at preventing symptomatic disease. Will the Tiger team still be at the half shell? I think they're there now. Where are the drive-through testing places? We were doing drive-through testing for a long time. The decision was that lots of places want to do it themselves. So all of the clinics in town now have testing materials. So all of the clinics are doing it. Many of them are doing it outside. So at our clinic today at Aviva, people were doing it, in the parking lot about this. So Kat says, would you describe how it feels to be severely sick or dying of COVID? People don't seem to think it's a big deal. Well, I've not been sick with it, so I cannot tell you firsthand, but I've read a lot of stories. So there are a couple of things that happen. One is if you get sick with COVID, frequently you're going to be on your own. Family's not allowed to visit because of the PPE requirements, those kind of things. So in many cases, these people get sick, They're in the emergency room. The hospital says, well, you're going to need to go to the ICU. And then they said, well, but we can't have any visitors. And so this is the last time you see your family face to face is the emergency. That to me would be the most heartbreaking thing. Then what people are feeling is that they're feeling like somebody's sitting on their chest, it's so much pressure in their chest, or that they're underwater and they just can't breathe, and they're just hungering for air. A lot of times when people die, the way they die is they say, well, you're getting worse, we're going to need to intubate you. So we're going to go ahead and basically put you in a coma and then intubate you, and then either you don't wake up and die, or you wake up days or weeks later when they take the tube out. Many of the people who survived have just described what an incredibly harrowing experience this has been. So that's a problem. So there's so much information out there. What can we believe? Well, I don't know if you can believe me, but I have no dog in this fight, right? I'm not making any money on this vaccine. I have no political future. I don't really, I mean, I've been here a long time. I just care about my patients and my friends and family. So I don't know what you can believe. And it's sometimes hard for me to figure it out. So that I've heard that fully vaxxed people are getting it just as easily as unvaccinated. No. Vaccinated people have about 75 to 85% protection in getting the disease, and then 90% protection in going to the hospital. So I think that, fully vaccinated people getting it just as easily as unvaccinated is not true. Now, there was a story about Barnstable, Massachusetts. So I did my training in Boston, and if you ever looked at Boston, there's a little arm coming out, which is Cape Cod, and at the tip of the fingers is a place called Provincetown, which is a place where lots of people like to hang out. It is like the party town on Cape Cod. And there was an outbreak in Cape Cod where there was Delta variant, and about 800 people wound up getting the disease. Many were vaccinated. Well, it's because many of the people who were there were already vaccinated, so not surprising that many of the people who would get the disease would be vaccinated. And what they found was that even in vaccinated people who got it, some had transitory high viral loads and could give it to other people. But of the 800 people who were there, only 4 were hospitalized. Only 3 were vaccinated, 1 was unvaccinated. So again, if that were the story, that there were 800 cases in Douglas County and 3 people in the hospital, we would say, well, that's a lot of cases, but we wouldn't worry too much. We have a little over 120 cases today, and 42 people in the hospital. That's what the big concern is. It's not that we have so many cases. I mean, so many cases without people getting sick would be somewhat important, but what is so worrisome is the number of people who are sick and dying in hospital. 4 deaths today. Veronica says, what percentage of rapid tests give false negatives? So rapid tests are really pretty good. If you take the test while you're symptomatic, there are not very many, probably less than 10% are false negatives. Now, if you take the test when you're not symptomatic, before your symptoms start, or a week or so after your symptoms start, then you do start seeing some false negatives. The next question, are the symptoms any different with Delta? Very interesting. I've done a lot of case interviews over the years, and over the year and a half, and talked to people about where they've had disease. Early on with the ancestral strain and with the alpha, what you'd hear was, I got a fever and then this cough, and geez, I lost my sense of smell and taste. And yeah, I had a little diarrhea, yeah, I had a little headache, yeah, I had a little sore throat, yeah, a little runny nose. But really what they were talking about was the fever, cough, and loss of smell and taste. What's interesting with Delta is that early on, a lot of people have a lot of runny nose, so they think it's allergies or a sinus infection. They have a lot of sore throat and a lot of headache, but not a lot of fever, not a lot of cough, not a lot of loss of sense of smell until a few days later. So what happens, they think, oh, runny nose must be allergies. Oh, runny nose must be a sinus infection. So they go about their daily duties and spread it to a lot of people before they get the more typical symptoms of COVID. So sore throat, headache, and runny nose, much more common early on with Delta than with the previous forms. So could a negative quick test that gets sent away come back positive for any type of COVID? So sometimes they'll do a quick test. They think, well, I think you've got it, so this may be a false negative quick test. And then they'll send away a PCR, the much more sensitive test that's much slower. And so, yeah, it could, because the ones that you send out are so much more sensitive than the antigen test. So it is possible that it could come back for COVID. So Eleanor says she'll be wiping down groceries or packages now, given how contagious Delta is. Again, we don't think it spreads very much on that. We think this spreads in the air with aerosols or airborne. And unless you're going to be licking down the packages or whatever, we don't think there are very many cases that are spread that way. Now, if this would make you feel more comfortable, certainly go ahead and do it. It's certainly no harm in doing that. But I think the best way to protect yourself would be to get vaccinated. Stay home if you're sick, even with, you think, just a runny nose or a sore throat, and get vaccinated. So are there any cases where highly suspected that the person got it shopping in a store or eating in a restaurant? Well, we certainly know about restaurant cases. So we certainly know that people at a restaurant have gotten it from eating at a restaurant. In fact, we have one well-defined case where somebody was eating at a restaurant, gave it to a staff member. We have lots of outbreaks in restaurants. So we think restaurants are there. Shopping in a store is a little harder to tell, right? Because if you were eating at a restaurant, you might remember who your server was. You would certainly remember who your guests were. At a shopping store, much harder to remember who you were next to in the rice aisle, and so it's a little hard to know about that. It's mostly workplaces and gatherings. So again, overwhelmingly, it's workplaces, well, households, which is the number one area, workplaces and gatherings. How are NSAIDs and antihistamines affecting the Moderna vaccine? We don't think at all. Now, what we do know, remember, early on with the Delta, a lot of people complain of runny nose, so they think, oh, it must be allergies. I should take an allergy medicine. The news is that in August in Douglas County, there are not very many allergens out there. Very different from June and early July, where we have some of the highest pollen counts in the world for grass, and in the time before Memorial Day, where we have very high tree. But August, there are not a lot of pollen here, so people should not be having a lot of allergy symptoms now. I heard that it's vaccinated people getting unvaccinated people sick. No, it's people who are sick getting other people sick. Vaccinated people and unvaccinated people can both get sick. They can both spread the disease. They seem to spread the disease in the same way when they get it. But overwhelmingly, 90 some odd percent of the hospitalizations, 80 some odd percent of the cases are in unvaccinated people. So all this stuff like, oh, don't get vaccinated, doesn't make any difference, don't get vaccinated, you'll spread it, is just not true. Being vaccinated is the very best thing can you do. Is there a complete life cycle of COVID? Yes, so the life cycle of COVID is that your body starts making COVID, your body then starts making antibodies against it, and it kills it off so that it's no longer competent after 9 or 10 days, if you have a normal immune system and if you're not seriously ill and intubated, that changes it a bit. So if 18 days later the mRNA is dead, so mRNA is not living or dead, mRNA is a chemical, so the mRNA is there. The virus, though, is not what we call competent. You could never culture it or find it in the nose after the time. Is our own bodies killing it to make it dead? So our own bodies are killing the virus to make it dead. So it's basically just like the windshield kills those bugs that you drive into. Our bodies and our immune systems are killing this virus, but still there's some debris left in your nose. Are indoor small group activities safe for vaccinated people, or should they be avoided? Well, 4 weeks ago, I would have said, boy, if two groups vaccinated, risk indoors is really low. The risk now is a little higher. There's a lot more disease circulating. And again, with the Delta, even vaccinated people, we're still seeing them occasionally. So I think small group indoor activities are worrisome. I was supposed to do one tomorrow, and I said, no, thank you. I'll do it by Zoom. Should they be avoided? Yeah, I would avoid small indoor activities. I mean, if you can do it not with other people around, I would do that. So one of my loved ones believes all that Dr. Powell said and is more worried about getting the vaccine than getting COVID. Well, again, there are 42 people in the hospital with COVID. I don't think there's been a single person in the hospital because of the vaccine. I mean, you just have to look at the numbers and see it. Now, these are new vaccines. So mRNA vaccines are new vaccines. The adenoviral vector vaccines are new vaccines. But hundreds of millions of people have gotten these vaccines. There's never been a vaccine which has been more carefully scrutinized than these, and it seems to be safe. Now, what happens if people stop? We stay at our 57% or so of people getting the vaccine. That means there's still like 60,000 people out there to get the disease, and we're likely to wind up with 100, 200 a day case counts for 6 or 8 weeks. Our hospital is likely to be overloaded, so that if you get a heart attack or a car wreck, it's going to be hard for them to do it. And so, I mean, that's the way to do it. One of the ways to do it is just let this blow through. But if this week is any idea of what letting it blow through looks like, it's awful. So does the county follow up with everyone that tests positive? We certainly try. Marianne asks. We certainly try. All of us have been doing calls. So I've been doing, case investigations and calling people. A lot of people don't answer the phone. It's shocking how many people have the please leave a message at the tone, and then you hear the mailbox has not been set up or the mailbox is full. And so we can't really leave the message. We do try, but it's hard to see. So Eleanor asks, how accurate are the Binax home tests in detecting the virus who are asymptomatic? Not really been well tested in asymptomatic positive people, right? So asymptomatic positive people, you'd have to say, why are you testing them? The Binax tests are great for people who are symptomatic. They are, it's hard to know in asymptomatic positive people how good they are. So I think the Binax, again, are designed for the use in symptomatic people. So what is the risk of sitting in a room with unvaccinated people when someone is vaccinated wearing a mask if they're closer than 6 feet apart? So a lot of questions, a lot of variations. What kind of mask? If you're wearing an N95 mask, much better protection than if you're wearing a cloth mask or a mask over your chin. How many people? The more people in the room, the more risk. How long are you there? If you're there for 1 minute, obviously less risky than if you're there for 3 hours. And then are some of those unvaccinated people symptomatic or not symptomatic? So it all varies. So currently, we probably, if you just pick any one random person in Douglas County, we're following 893 cases or something this week, which means that about 1 in 120 or so are positive. You just picked up 120 people and just tested them all. Likely 1 out of 120 would be positive. So if there are 120 people in the room, chances are pretty good that one of them is positive. If there's one person in the room, chances are less. So it's all of those factors. How many people, how close are you, how long are you, and what are you doing? If you're talking loudly or singing, much more risk than if you're all just sitting there working on crossword puzzles. So Linda says, can you talk about pregnant women getting COVID? I heard your immune system isn't as good when you're pregnant. So when you are pregnant, your immune system is a little different, right? You're carrying inside of you some foreign material, some foreign genetic material from your spouse. And so your immune system is kind of tuned down during pregnancy. So there's certain infections that you otherwise don't get that you seem to be much more likely to get when you're pregnant. So there's a thing called listeriosis, is the thing that you get from cheese and ice cream and dairy products. Listeriosis almost never affects a person with a normal immune system. People with weakened immune systems, old people, and pregnant people seem to get it. So your immune system is a little funny during the time that you're pregnant. So pregnant women, when they get COVID, get sick, and they do seem to have an increased risk of severe disease and death during that. Now, some of that may be because of mechanical factors. We think obese people have more trouble with this because the belly pushes up on your lungs. Similarly, pregnant women, the baby pushes up on your lungs. So some of it could be mechanical, some of it could be a change in the immune system, but there's no doubt that pregnant women are at increased risk, and pregnant women should be vaccinated. So Denise says, what's the definition of a severe case? Yeah, there are a bunch of definitions. We typically mean if you get hospitalized, you likely have a severe case. So we don't hospitalize people for other reason with COVID. So if you get hospitalized because of your COVID, not hospitalized and you have COVID, but hospitalized because of your COVID, that's how we do the shorthand definition of a severe case. Some places say, well, you have to be on more than 5 liters of oxygen. Some places say you have to be in the ICU. Some places say you have to be intubated. So we just basically stop it at hospitalizations. So does the mRNA virus change your DNA? So I think you're meaning the mRNA vaccine change your DNA. It absolutely does not. It doesn't even get to the nucleus where your DNA lives. So the mRNA vaccines do not change your DNA. So what is the likelihood of an unvaccinated person showing symptoms having a false negative on the rapid test? Low, but not zero. So again, the rapid tests are very good, at least 90%, and it would be both the unvaccinated or vaccinated person having symptoms. So if you get the disease when you're vaccinated or unvaccinated, there's not a lot of big difference. But if you are an unvaccinated or vaccinated person showing symptoms, having a false negative on the rapid test, it does occur. So we certainly know people who have symptoms who get tested on the first day of symptoms and it's negative. We say, well, stay home 2 days and get retested again, and then they're positive 2 days later. Probably was just a little too early for the rapid tests to show up. And so again, if you have symptoms, your rapid test is negative, wait 2 days and check again. So how are kids doing with COVID? I'm really nervous about sending my kids back to school. Yeah, school, I don't know what's going to happen with school. In Douglas County, we've not had kids admitted to the hospital for this so far, knock on wood. But certainly we know in Tennessee, in Arkansas, and in Florida, the pediatric hospitals there are reporting lots of cases, kids on ventilators, kids really, really sick. I met with a person who worked in ICU at the Children's Hospital this morning, and they're not seeing a lot in the hospital yet. But again, in the rest of Oregon, they're not having to use huge numbers. So we had 120 cases at Benton County, which is about the same number of people, at 12. Multnomah County had fewer cases some days than we in Douglas County do. They're still not seeing a lot of cases up in that area there. Somewhat, probably luck. I mean, we had really bad luck to have 5 separate Delta introductions over the space of 2 weeks. I mean, it was like, could we be more unlucky? You know, someone comes from Arkansas, someone comes from Oklahoma, someone comes from Alaska, all places where there's a lot of Delta. They all came in at once, and then it really spread. So we had really bad luck. I mean, they'll eventually get more cases of Delta. But again, the low vaccine rate and not masking and gathering together at the fair and other places are really a risk for this spreading. So Josh says if we only have 10% or less breakthrough cases, why are numbers so high? So here is about the numbers. About 44,000 people in the county are vaccinated. So 44,000 people are vaccinated. That means, you know, the 112,000 people, 68,000 who are not vaccinated. So with 68,000 not vaccinated, those 68,000 are out there to get infected, and they do, and they're getting infected at the highest rate ever. So the risk for a vaccinated person like myself now is high, but about where it was last year. So about where it was last year. For an unvaccinated person, the risk is 10 times as high. So when you look at the case rates for the vaccinated people, it is really high. So I don't know what all of the ones say because we have to do this, but let's say out of 100 cases, 10 are among the vaccinated group. So 10 are among the 40,000 who are vaccinated. 90 are among the 60,000 who are unvaccinated. It's going to take a long time to get all of those people immune. So you can get immune from natural immunity, and that's one of the things we want to talk about later. So you can get it from natural immunity, but even at the rate we're doing, adding 120 cases a day, maybe another 100 cases out there we don't know about, we did that many vaccines in 1 hour. So in 1 hour, we could vaccinate that many people versus that many people getting it from the wild disease. When we vaccinate people, we had nobody in the hospital from the vaccine. When we do this, we have 42 people in the hospital with vaccine. I mean, the numbers seem really, really clear to me that the vaccine works and it's the thing to do. In addition, there's a recent study from Kentucky published in the Morbidity and Mortality Weekly Review, sort of the Bible that we look at here, that looked at people in Kentucky who had a previous infection, some of whom chose not to get vaccinated, some of whom chose to get vaccinated. They had more than twice the people who had the disease and then didn't get vaccinated, more than twice the rate of disease for people who got the disease and then chose to get vaccinated. And again, we're seeing every day people who previously had the disease and are now getting sick again with Delta. So again, previous infection helps some, but not as much. Vaccine helps more, but not perfect. And so we need to do all of the things we can do to slow this down. The first would be, if you're not vaccinated, please get vaccinated. The second would be avoid crowds. I mean, right now, I'd be really reluctant to go ahead and be at a big meeting where there was a bunch of other people. If you're indoors and not sure about what's going on, wear a mask. Masks are not perfect, but they certainly help a bit. And then the other one is, if you've got that runny nose and it must be bad allergies coming up on the 10th of August, it doesn't happen very often. So if you have not had bad allergies before and they come up on the 10th of August, you should consider that maybe you have COVID. Stay home, get a test, don't spread it to everyone else. Again, if people followed any one of those things, masking, avoiding crowds, vaccination, or staying home when you're sick, we would not have the number of cases we have today. So it's all of those things, none of which is perfect, but all of those together make it better. So if you're not vaccinated yet, please go and do it. Again, if people are really, really worried about the vaccine, I'd be happy to talk with them about that. I mean, again, you know, we 1,200 vaccines at the fairgrounds, and then you look 4 days later and you say, okay, if the vaccines were causing all these things, how many people were hospitalized with this? 0. We have today 120 cases, 42 people in the hospital. 42 people in the hospital. Some of those are going to die, and the hospital is now so full that if you or I get in a car wreck, have a heart attack, Mercy's pretty darn full and really at a dangerous spot. So do those things. Again, if you have more questions, we'll do this again. You can send them to me. I'm sure there's going to be a lot of people disagreeing with me, but please go ahead and send those questions, and we'll do this. But in the meantime, stay safe. I know there's a lot of heated rhetoric out there. I try so hard not to be part of that heated rhetoric. it's just sad to see so many people sick, and to see now in this last week, 3 people who are relatives of friends who died. And none of these people were ready to die. So none of these people were like, oh, you know, they're in a nursing home with 32 other things and anything can get them any minute. Some of these people were young, healthy people who were looking forward to retirement. They were looking forward to being with their kids. They were looking forward to being with their grandkids. They were looking forward to retirement after many years of work, and now they're gone. And we can prevent this, and we can prevent this by getting more of us vaccinated, avoiding groups, staying home if you're sick, and if you want to wear a mask. Again, Dr. Bob Dannenhoffer, Public Health Officer in Douglas County. Be safe and be kind. Thanks.